Hey, everybody. Hope everything's going well. Go ahead and unmute yourself, type in. Go ahead and fire away.
And go ahead, Deborah, then Lolly.
Hey, Deborah.
Hey, Greg. Um, good to finally have time to catch up with you guys. I really enjoyed Sunday's Astara, where you
Oh, good.
showed us, yeah, you showed us the mudra.
Mm-hmm.
Um, and I tried it this morning again
Mm-hmm.
and had it more lower in my lap, over instead of like at my heart. And as soon as I connected the rings, I felt very centered.
Yeah,
Uh,
good.
it
Yeah.
was like immediate. Um, so it felt very powerful. And I was wondering, is there a difference in if it's sort of left over right, right over left?
No, it needs to be right hand like this and then left hand like that.
Um, the right hand and then the left
Right
coming in
hand's on the chest, and
on the
then the
chest.
left hand is the one that's like laying sideways.
Okay. And so when I did it this morning,
Mm-hmm.
I had, because I was sitting sort of cross-legged and upright, I had it where my arms could rest, so it was low in my lap. And that's how I felt it. And it actually felt more powerful there than when I did it on Sunday up high. Um, so I'm kind of curious what that is doing.
Uh, it could have been like a little bit overstimulating to the lower centers. Like I'd
Okay.
keep it high. Yeah, I'd keep it
All
up.
right.
Yeah.
All right. Well, that's partly
Keep
why I'm
keep it up
asking.
at the heart. Yeah.
Okay,
Yeah.
very good. And any more that you want to say about the mudra itself, except for um, sort of
Good,
what
good
you
for treating like things like agitation and in the body. Like abandonment's a perfect example of what agitation is. We always have our stories about like the
Yeah.
things that happen with abandonment, but really the big issue is the agitation in the body. Because it's a very strong primal drive to fit into um, the group, the herd, the collective, whatever you want to call it. And so with that mudra, you're calming down the body in a much deeper way. And a lot of times when we talk about the intellect, I mean, I don't know that I've said this part before, but not all intellect is the same. There's some intellect that depending on the level of agitation in the body and the person, that's really a byproduct of more instinctive responses. And then when people have a little bit more refined intellect, it's still actually a reflection more of the astral realm or the astral body, the emotional body, than it is of mental function. And then as a person, you know, kind of goes through and calms down the body and purifies the emotions and the emotional patterns and things, eventually it will start to develop like the mental body. And so that's usually somebody who's been doing a spiritual practice or some sort of, practice for a period of time. So in like the Tibetan tradition, they will call that like a thunderbolt being or a diamond being, or the perfect practitioner when the mental body is developed like that. So we're all kind of striving for that, but it just helps to elevate. It calms down the body and it calms down the emotions, but it helps to elevate the intellect to uh like a better version of itself, you could say. And makes the potential for intuition, like the intellect being able to process and let the intuitive mind you know, like play with the intuitive mind. You know, there's times where the intellect is like, you don't get to come in here, and we really can shut down intuition. And so it's a way to open up that intuitive process. And really what you're developing is the cognitive ability to recognize your true nature or your higher nature. And so when we go through and we treat all the different aspects of the aura, you know, you're unwinding like the conditioning that's happened both with the things that have happened and the things from other people, but also what you kind of incarnate with, you know, the things you come in with. And so, you know, we have our baggage, so to speak, that we need to be able to work through. And, you know, sometimes there's a lot to work through. And so it helps the more that you're able to cultivate intuition, the more that you're learning your way out of whatever the issues are, rather than just repetitively doing them over and over again. And until we start having like a little bit more of the higher cognitive functions, we just kind of keep repeating the pattern over and over again. You know, we might change clothes, we might change situations, but we kind of keep bringing that same pattern with us wherever we go. And so the use of that mudra is tied to the third aspect of the aura, the way that I've laid it out, which is the dynamics of the aura. So you're helping to develop the you're refining the intellect, and you're cultivating the ability to direct and control your intuition rather than just having it kind of pop in from time to time. You want to be able to direct it. You want to be able to go up into the ethers and pull things down or go beyond the senses. And then you also want to be able to turn inward. And so that mudra is to help all those processes. And so, like we were talking about over the weekend, I don't know that I mentioned it in the Astara session, but we were talking about it in class. Is you know, there's a mudra, there's the I shared the mantra with them, right? The Om Vajra Sattva Om, which is also associated with like that perfected like practitioner, you know, the thunderbolt being or the diamond being. And thunderbolt being or diamond being just simply means like the development of the mental body. And so you can use the mantra with it as well. And if you want to use like a stone to support it, Larimar is a good stone to kind of wear. It's not a replacement for that mudra or a replacement for the mantra, but you know, it's nice to be able to support the work that you do for unwinding the aura, you know, in between your sessions, or you know, just a way to like keep it from, I don't want to say backsliding, but you're just like maintaining it, you know, you're stabilizing it a bit more, you're integrating the shift or the change. And so different stones will help different aspects of the aura. And so Larimar is really good for that third aspect. And so the thing that's also good for that is one is the fire ceremonies are good for that, but you know, that's hard for most people to pull off. But also the use of like the metal bowls, the Tibetan bowls and bells. If you use it in a particular way, usually with the metal bowls, you keep your awareness on the spine. And if you do the arms and legs, you go deep, like close to the bone. But usually the way to do it is you keep your awareness on the spine. With the bowls and the bell, you do different things depending on what you're trying to do. And we're going to start doing mystical practices with those things at some point. but you know, it's just another way to augment that practice. Yeah.
Great. And I just put the Larimar in my shopping cart right before.
Right, right. Yeah. Well, like it's funny because over the weekend I was like, you know, I'm teaching, I should be wearing my Larimar mala. And you know, because I used to make Larimar malas you know, 10 years ago. And I couldn't find it. And I was like, ugh, like every break I was hunting around the house. I couldn't find it. And I completely gave up. I was just like, eh. And then we're shuffling things around in the house, you know, with how we have the layout. So we were doing some rearranging, and I found my Laura Marmala after class on Sunday, and I was like, yes, because I was about ready to buy a new one. Like I was, you know. So yeah, I hear you. Larimar is amazing. You know, it's the stone that Edgar Casey had predicted that would be found, and it's very good for devotional practices as well. Like when you wear Larimar, it makes it much easier to integrate things into the heart, and especially if you're trying to do any sort of devotional practice to a teacher or a deity, it makes it very easy, or I should say easier, to hold that deity or you know, great teacher or whatever it might be in the heart, which, you know, once you get it in the heart, it starts to integrate and starts to go deeper. And so, you know, in a lot of the classes we keep going deeper into the heart, trying to access the physical permanent seed or the heart seed, and it makes it easier to go deeper into the heart like that. And so Larimar is very soothing, very healing. Yeah, very soothing.
Thanks. Thank you so much.
Yeah, you're so welcome. Enjoy it. Yeah, let me know how that mudra does for you.
Yeah.
That
Will do.
mudra is you see the
Yeah.
like
try to
this,
look
yeah.
better.
You see this. This is they call him his name is Zangapa. And they refer to him sometimes as the second Buddha. And he was a founder of like the tradition of the Dalai Lama, the Glug or Glugpa, and father also of like the tantric practices and things like that. And so that's the mantra that gets used for that. Like you see him a lot just sitting in meditation with his eyes kind of slightly open with doing that. And so the practice is associated with what you would call like impermanence practices, which is like another way of saying wisdom practices. And so, you know, they use like the tools that we use are all tools from that lineage. And so, like, you know, the Dorje and the I mean, Dorje is used in a lot of different things, but like the Kartika and the Purba and, you know, all those things, the Damaru, um, they're all used in that tantric practice. So yeah, you
Thank
guys have
you.
been doing essential oil versions of that and things, and like there's a Kabbalistic counterpart, like in a Christian counterpart to it, but I like the Buddhist stuff because they got the mudras and the mantras, you know what I mean? There's other ways of working it, but you know, I'm always kind of drawn to the Buddhist stuff. Yeah.
I like the Buddha part because it
Mhm.
separates it from all of the negativity from my childhood
Yeah,
of the
I
yeah,
think that's my thing too. Like, you know, I grew up in Catholic schools, so like, you know, part of me rebels against some of that. And it just feels good and different. When I
yes.
was in high school, I used to read Buddhist books all the time. I didn't understand any of it, but I used to read it all the time. But you know, yeah. Well, good. Let me know how it goes.
And then go ahead, Lolly, then Letty.
Hey.
Yay.
So yeah, the class this weekend was pretty amazing. And it's interesting how my mind is just feels so quiet after the classes. So, okay, let's see. I have a couple of super short ones and then a couple of big ones. When doing the spagyric tinctures, I'm doing a few of them. Can you just take them one after the other? Is that okay?
Pretty
Do you need
much
to
what I
wait?
do.
Okay, great. So I'm on the right track with that. That was easy. Then we talked last week about the vagal tone, the body tonic, and then there's also the oil blend. And I have different notes on that because I asked, because from my understanding, you can take the blend internally. But last week you said, I think you said yes, but it has benzoin and
yeah, benzoin's okay internal.
Okay, so you can take the
Yeah,
so I
let
guess
me
my
just
other
double check and see
okay.
what we're dealing with here.
Well, and we have herbal vagal tone.
Okay, so yeah, I actually wouldn't take it. It's not the benzoin, it's the spike lavender.
Okay.
Little too high camphor content in spike lavender to do
Okay.
it. So I would do that topical, but we do have the herbal vagal tone.
Oh yeah, I have that.
Yeah.
I just want to check. Okay, so
Yeah,
I was okay. And then if doing spikenard before going to bed, I tried that a couple of nights. It was kind of amazing. It's first time I'm doing spikenard internally. Do you need to do it right before bed? Would you do it like an hour before?
I mean, it depends on your like your temperament at the time, you know what I mean? Like sometimes I take it like right as I'm going to bed, and sometimes if I'm a little wound up, I start taking about an hour, and then I do it a little bit more until I get ready to fall asleep. So like if I'm a little wound up, I may do it an hour and then a half hour, and then maybe a couple in right before I go to bed. And then if I'm still not like falling asleep deep enough, I'll like lay there for 15, 20 minutes and then take it again. And
Okay.
so usually that will get it.
Okay. And then now that I think about it, like if I'm like doing different things, like one didn't work, can I mix or do like spikenard and then sleep lady sleeper
sure.
and
Yeah, yeah.
Okay, cool. Those
Especially if they're all
ones.
like pushing you towards sleep, like
Yeah.
Okay.
Okay, so now let's go to the bigger ones. So sinuses. We talked a little bit about that on the weekend because I had this weird thing that I wasn't really smelling the oil, which is fine now. But what I've been dealing with, and sometimes you have stuff that you kind of get used to it and you don't even think about it.
Oh yeah.
So I have this like post-nasal drip, which I never even knew that was the name, pretty much for the last year and a half or so. So it sometimes feels like there's like more mucus and it's the left side mainly, or like something kind of stuck, and it's fine. I feel fine overall. But what happens is that it's connecting to my ear that's being clogged for the same amount of time, which connecting to my TMJ.
Right.
So now, I kind of got used to this annoying thing, which the most annoying thing for me is like the ear clogging. But now, that we do more work together, I'm like, okay, what can I do to maybe help that? Because a few weeks ago, you were talking to Robert about sinuses, post-nasal drip. You mentioned basil, you mentioned bay laurel, you mentioned rosemary verbena.
Rosemary verbena would probably be like the first choice. Just because you're trying to, like, the thing with especially like chronic sinus issues is it's not an emotional or mental stress, but it's a kind of physical stress in the body. And if you look at it clairvoyantly, there's a lot of like grayish red prana in the sinuses. And so it's tied to the aspect of the nerves that are associated with more like the sympathetic nervous system or fight flight, like losing a bit of tone. And yes, there can be allergies, and yes, there can be other factors, and whatever that might be, but still those put the body through a kind of stress. And so the idea is, for one, rosemary is a cephalic and increases blood flow to the head, which increases blood flow to the sinuses and things like that. It's very good for breaking down mucus and working on the respiratory system. But it's also one of the oils that's very good for toning up that sympathetic part of the nervous system. And so that's why we also use it like in ANS support. We use things like tarragon and rosemary and anise, and tarragon and rosemary will do it. It's just that rosemary is a little bit better for sinus related things. And so it's not a quick fix. Like it's something that takes a little while, but if you take a couple of drops, maybe a couple of times a day, or at least spend a bunch of time inhaling it, over a period of time, it will start to change the nature of the sinuses and will reduce it. And basil's good for undoing the effects of stress and can minimize some of the stress and things like that. But you still want to tone up that part of the nerve. And you can still support it with other things that like break down mucus and those kinds of things, but every once in a while, like if you have like something where it's just like it's getting better and then it comes back and it's getting better and it's coming back, then you need to step up treatment associated with inflammation. Because part of what happens is your body goes into a little bit of an inflammatory state, but especially the mucous membranes will go through a phase of an inflammatory process or inflammatory state. And so the more that you reduce inflammation in that cycle, the more that it will break it. And like one of the things that, like, after somebody was going through, like, say, COVID or a cold and flu or something, they get through the cycle of the virus and the effects and everything, but they still can't quite pull out of it. After everything is gone, they still are kind of having sinus issues or breathing issues. A lot of that is still inflammation. And so the more that you kind of step up your effects or your effort to reduce inflammation, can be helpful. So like at the end of going through like a cold or flu thing, you can use something like helichrysum. German chamomile is probably they're both a good choice, and it depends, especially with COVID, because the issue was that there was always the potential also of like fascial lesions in the respiratory tract, and also potential for clotting issues. And so some people, if there was fascial lesions, I would tell them helichrysum. But if you're just trying to clean up after the metabolic waste, you could say, after somebody's gone through a cold or flu, or like even really bad allergies or something like that, is German chamomile. For one, it reduces bronchial spasms, so it helps your body to relax the stress state. And two, it's an anti-inflammatory, but it will also increase the white blood cells for a short period of time, which helps the body to clean up the metabolic waste after you've gone through a viral or bacterial infection, or even an allergy issue. And so it's just a way to go through and like mop everything up after the fact. You don't do it for very long, 3 days, a week or something like that. And then you could go back down to like standard, like anti-inflammatory kinds of things, like, frankincense, myrrh, turmeric, black cumin is one that I like to use a lot. But anything anti-inflammatory after that, and that really will help break the cycle In the old days, when I was treating people who had severe neck injuries, like whiplash and things like that, one of the things, like if they had a hard time breaking out of that cycle, I would have them use digestive enzymes in between their meals. Like there's this company called Wobazyme, and they make, it's a German company that makes these digestive enzymes that are used as like an anti-inflammatory. You know, you use them not so much to digest your food better, but you use them almost like a replacement for ibuprofen. And you use them to reduce inflammation in soft tissue or in the mucous membranes, things like that. I actually even would use them sometimes in treating people when they had really bad inflammatory cancers. And it's a way to use an anti-inflammatory to try to break that inflammatory cycle so that the body can shift out of that, just kind of repeating it over and over again. And so I would say a multifaceted approach when it comes to like really chronic sinus issues. And do you remember the name? Like the ear cones. We get these really big ear cones, like they're really wide. Like I just did, when do we do your ears? Like Saturday night or Sunday night or something?
Sunday.
Yeah. And you know, regular ear cones, they're not very wide, but you get these really wide fat ones and they'll pull out all kinds of stuff out of your ears. And whenever you kind of suck things out of the ears, it opens up the sinuses more. Like the ears are a place, like you said, you're having issues with your, like you can open up the ears that way. And then the other thing is the roof of the mouth. Like if you put some oil on the like cypress or something and then get in and rub the top of your roof of your mouth, just kind of like side to side or back and forth, it will stimulate some circulation and it will a lot of times help the nose to open up and let go and let go of a bunch of the mucus, you know, calm it down. And so, you know, there's little tricks like that, but still bottom line is still got to be taking the rosemary verbena and still got to, you know, do some of those other things.
So I do everything you said.
Oh, good.
So this thing, so first of all, I feel fine. So this thing has been going on for like a year and a half, probably because it was
Could
like
be a little bit. I mean, the other issue for when somebody has, like you have like your jaw issues, is there's trigger points in the muscles of mastication, like the pterygoids, and there's this muscle that's under here called the digastric. And when they have trigger points, they cause congestion in the sinuses. And so it's a byproduct of that. So I mean, you're still needing to like work the jaws and the throat a little bit,
so
but it's
that's
not the throat here. It's like the throat
no, it's
here.
and yeah, and I remember you were actually showing that I think the other day as well, and I've been actually doing that
Oh
earlier.
yeah, probably. Yeah.
So basically, yeah, so it's been going on for like a while. And then when it started and I had the ear clogging, which also been going on since May of last year, I've been through everything and I've been through those like cleaning the ears, which with like even what was it, like peroxide or something like that. Somebody did that to me, one of the most painful things ever. I don't even know why, because it was probably done incorrectly.
Peroxide's usually used for water in the ear. Like, I mean, it kind of breaks up some real superficial earwax, but and you know, there's those things that you can buy in the drugstore where you put stuff in the ear, like little drops, and you do it every night, and it helps break up the wax. But it does take a long time.
But that's the thing, because when I saw a doctor for my ears exactly a year ago, because I was supposed to travel, she looked at me, she did all the tests and everything was fine. And she was the one who was like, it's a TMJ issue, not even the ears.
Right.
But what happened is like something like the other day that my nose felt a little bit off, then it triggers the ears more, then it triggers the TMJ more.
Yeah, you
So,
gotta keep treating all three. You just gotta keep working it until it starts moving in the right direction. Like
so
that's the
base,
thing that used to happen with whiplash patients is you're kind of doing damage control until you can get it to tip in the direction of where it starts getting better. And you still work the sinuses and those kinds of things, but when you have like a lot of muscle tension there, you got to keep unwinding the tension in the jaw and the upper part of the throat.
so basically keep, because right now what the new thing that I've been adding is really the rosemary verbena. That the taste
Mhm.
is, well, I'll have to deal with that. But so that's the new thing. But other than that, I'm taking helichrysum, I'm taking
And
melissa.
like I think we've talked about like maybe using marjoram and things for your jaws and things like
So
that.
I'm doing that
You know
already.
what? You know what? I might switch up and do is do you have ginger?
No, actually don't.
Um,
I mean, I can order, but
no,
yeah.
let's see. I mean, I'm sure you have plenty of oils. Let's find some that you got. How about thyme linalool? You have thyme linalool?
Mm-mm, no.
Um,
Maybe have a tiny one from a class, but I don't think so.
how about yarrow? Do you have yarrow?
It's coming this week.
Okay. Maybe put a few drops of yarrow in with like a little lotion and then rub it on your neck and a little bit on your jaw. And do that like every night for like a week or two.
Okay.
I mean, the yarrow does a couple of things. Like the yarrow will reduce inflammation, but it's also an antispasmodic. And so we're kind of getting a twofer there. Let's have you try that. Yeah.
So rubbing on the neck and
Yeah.
the jaw. Okay, and that's
Ginger
an
is very good. Ginger is very good for trigger points. But the thing with trigger points is they're not always just going to release right off the bat, because they're complicated. Like there's neurological component, there's a lymphatic component, there's a issue with the nervous system and how well it's balanced. All of these things kind of play a role. And so, you got enough things in place. Like the ginger might. Sometimes I would use ginger. Sometimes I use ginger with cedar or ginger with a little helichrysum, and would rub it on the trigger point areas. But there's also a trigger point blend. But let's try it with the yarrow first and see how that treats you.
and then okay, and then the helichrysum by itself is not gonna do that. You would mix it
So
with the
sometimes it
ginger.
does. I mean, that's the thing. Like you just have to kind of keep treating until you find your jam. You know what I mean? Like for one person, helichrysum kind of knocks it out. But when you have a little bit more of like an accident, the history of an accident, or a neck issue or
Mhm.
jaw injury or something like that, then you're having to really work it because you're also dealing with like tissue trauma and things like that. And so it's not always straightforward on how it unwinds. I do like the next time I do have uh like an herbal antispasmodic that they used to use for lockjaw. I haven't put it on the site, but um then next time she places an order, we'll give her like a little sample of it.
Okay.
Yeah, next time you
Thank
order
you.
something, we'll
Okay.
just we'll put some in. Let's just see if it works for you. The one
Okay.
thing that I will say though is it does have a little tiny bit of cayenne pepper in it, and it can be a little tangy. You know what I mean?
Yeah.
So I would take it
Okay.
with water. I don't. I'm used to it because I've used it for like 30 years or whatever. But
Mm-hmm.
at first it might be like, mm,
And
you
okay,
know,
thank you. Yeah, I tend to
yeah.
just take things as is whatever it
Mhm.
tastes like, and then I move on. It's easier
Right.
than
Yeah.
yeah.
That's the way I am.
And then thank you. And then something like, because like even earlier when I worked on the area, I did spikenard. So spikenard is still gonna do
Mhm.
something that's different
Spikenard's still good
than
for
yarrow.
valerian, vetiver. Like
But the
I
yarrow
like
or
the yarrow because it's antispasmodic and pretty anti-inflammatory, and
okay.
so
Yeah, no, I'll try that. Okay. And then internally keep using now the rosemary, rosemary
rosemary
verbena.
verbena. Yeah, rosemary
Okay.
verbena. Yeah,
And
yeah.
and add the basil as well, just
You can add the basil, but like if I was to choose one, rosemary verbena.
the rosemary. Yeah,
Yeah,
yeah.
especially
Okay,
for
so
you. Yeah,
okay, so I start doing
yeah,
that. Okay, and
yeah,
then the rest of the stuff just keep doing what
yeah.
I'm doing.
And you can do the rosemary verbena a couple times a day.
Yeah. Oh, yeah. The taste is, but it's okay. I can get past it. Okay. Yeah, I'll do that a couple of times a day. Thank you. Yeah, because I noticed that, and I'm like, okay, this is, and all of these eventually supposed to start releasing what, clean up the mucus and open the sinuses.
Well, it's going to regulate the nerve and like make the mucus, the sinuses, and the mucous membranes function more properly. Yeah.
Okay. Okay.
Yeah.
Okay. And then the other big thing that's been happening, I don't know why. So let's talk about hair for a second. Hair growth. So we talked about hair growth and rosemary, but what I've been dealing with, I don't know, I've never had that in my life. My hair does not want to stay on my head. Like it's shedding a lot, like a lot. I've never had that ever. So, and I've been using rosemary. I'm using a couple of other things, for the hair. I haven't changed anything. I feel fine. Only thing is maybe more stressed in the last couple of weeks.
Yeah,
But
I would take some collagen, like
so
take
I'm
some form of.
taking, but that's the thing. So I'm already I'm taking the collagen stimulating bit, the vegan option. So it's the stimulating collagen peptides.
You might have to ditch the vegan part. Yeah.
Because I've been on
If
now
it's
on my
if it's
second
not
one.
working, I mean, usually like regular collagen will stop it like within a couple of days. Yeah.
So
What's
I
the
had a
brand that
feeling.
we use?
Yeah, I remember you.
Shared what brand
Okay.
with her.
Yeah.
There's the one with the
Yeah.
There's the one you sent me that's vegetarian and not vegan, that has like from eggshells.
Yeah. Yeah. It might not be strong enough. Yeah.
Even the eggshells.
What's the one that we
I mean, up the dose maybe first.
Yeah.
I don't know.
Yeah.
I mean,
Yeah.
I use less than the recommended dose on the box. Yes.
Yeah. I would bump up, like at least use the dosage, but I'd probably double the dosage. Yeah.
So use more of that
Mhm.
I'm using, and if that doesn't work, then switch the product.
Yeah. Yeah. I've never personally used the vegan version, like
Yeah.
because a lot of times that can be hormonal. It could be other things too, but the breakdown of it's usually like associated with the breakdown of collagen in the body. So if you provide the collagen, it usually will stop.
Okay, because I wasn't sure. I mean, I can try and experiment with more hair products, but I don't think it's
collagen. The
it's
issue is collagen. Yeah.
okay.
The hair products might help a little bit,
It's
but it's still collagen.
but it's the collagen. It's not
Yeah.
even like a Vegas tone. It's not even that.
But even if
pure,
it's
like
that, it's still the collagen.
it's still
Like
collagen.
it's whatever it is, it's still called the collagen. Yeah.
Okay, so then use more, and if that doesn't work, then switch to the other one.
Yeah. Yeah.
Okay.
Yeah, I mean, I have this, the one that I use, like if like because like I'm fine most times, but then sometimes I'll have my hairband, I'll pull it out, and there's like a handful of hair, and I'm like,
Yeah.
I don't have that much left. I can't afford that. So I'll take like a couple of days of that collagen, and it's done. Like it's over. Yeah.
And the one that you
The only time it doesn't work that great is when it's alopecia, which is an autoimmune issue, but
yeah,
you would
that's
like
different.
patches where they're
Yeah.
not working, and you still use the collagen, but you augment it with pantothenic acid, and it usually will stop it.
Mm-hmm. And then the one that you're using is like a regular one?
Yeah, it's regular collagen.
Okay.
Yeah.
I'm trying to avoid that. So, but again, if I'll have to kind
I
of,
hear you. Being vegetarian can be rough sometimes, but I just,
yeah,
yeah.
I'll experiment. I'll use more of
Mhm.
this one. If not, I'll try the other option, and if not, then the other one. Yeah. And usually I'm so used to being vegetarian because I've been doing that for, what, over 30 years or more. So to me, it's just like not even something to think about. Okay, so I'll try that. Thank you. And then just one quick question.
Mhm.
Something for impatience. I'm
For what?
like, yelling for impatience. Like I'm
Impatient?
just,
Actually, the yarrow might help that.
no, okay.
Yeah, yarrow is quite good for that. You know what else yarrow is good for is when you feel like triggered, like when you get triggered by something and you're starting to feel triggered. Yarrow a lot of times can potentially calm that down. But like getting impatient and everything, it's just an agitation that's like it still goes back to that tone in the sympathetic nerve that is causing some, quicker responses.
Mm-hmm.
Yeah.
Okay.
Yeah.
Okay. Thank you.
Yeah.
And then just one last question. Last week, I think it was that you talked about, actually it was the abandonment class. There was a pattern that we did at the end with the helichrysum, and you said that you can use also poplar balsam to change the behavior because there were two different things we were working on. One of them
Yeah,
was working with
it helps
emotions.
it helps to temper the behaviors. Yeah.
Right.
Like
So,
to shift behaviors, that takes up a bit more work, but it does kind of shift it somewhat.
and so what I was wondering about, if not poplar balsam, is there anything else that you can use as a substitute for that?
Off the top of my head, nothing jumps out, but I'll try to go back through and read my notes to see.
Okay, thank you.
I mean, there's
Because
there's
and then
more complicated ways of treating it, but it involves, a series of blends and an approach and everything like that.
mhm,
We actually will probably do it like towards the end of the year, but
okay,
your
because
your
I
your behaviors are tied more to planetary influences than people realize. And so a lot of times when people are having issues with particular behaviors, you could actually track it to planetary influences, but it's more complicated than just saying the planet itself. And so like I talk about how like, oh, the planets contribute to your ability to develop like the heart and the higher emotions, and eventually the cognitive processes increase or improve. In the old days, in the old healing modalities, the reason why they talked about planetary influences was it was actually about instinctive responses and behaviors. And so you could evaluate a person's issues, and then you would treat the corresponding like planetary influences to shift the behavior. And so I am going to teach that, but I have to lay the groundwork for the vibrational healing class. I have to at least get that one out before we can start talking about those deeper planetary influences. And so it's like setting up a shot on the pool table. You know what I mean? Gotta kind of set a couple of things up.
Yeah.
The big one is we knocked out all the aspects of the aura. And so that really lays the groundwork to do some really deep healing and really shift things for people. But in that category, we still have to lay down the vibrational healing.
Yeah, I'm excited about that as well. Perfect. Okay. Thank you so much.
I was doing some of the processes the other day. Remember, like I was doing them, and Samantha goes, "What's going on with you?" And I go, "I don't know." She goes, "You're just like happy and bouncing around and da 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 da." It's that vibrational work. It really, like once you lay the foundation with all the aura work, especially, like it. You know, we think of things very like literal, like with the intellectual mind, but there's reasons things are the way that they are. And even when we talk about the planetary energies, it seems like really out there, but when you look at like the principles and properties for each of the different aspects, if you just took the planet part out, it would look like clinical psychology. But because you're working the energy component of it, it makes it seem a little bit different. But it's just because our mind is used to seeing like anger is just anger, and this is just this, and this behavior is just this, and there's reasons in your physiology that things happen. And when we think of even the healing process or something psychological, we really don't think of the physiology or the physiological components that contribute or even cause it. And so we're going after all that stuff. It's basically it's alchemy, it's astrology, it's working with the angels. They're all not just separate practices, it's just different ways to work the things that we try to do to heal. It's just you're because you're working those things, you're invoking different kinds of energies to do things. Just like when you're doing healing, you use different things. It's just because we see things so literal, we don't have quite the foundation in modern times that they did in ancient times. So we have to kind of lay a little bit of a foundation before we go deeper in that. Otherwise, we usually don't stay with it, or it doesn't shift, or things just aren't in the right place to make the shift yet. So just laying the foundation is a big piece of it. Yeah.
So exciting, and to see how everything is coming together. Yes.
Yeah. I mean, I thought I'd be teaching this stuff like 10 or 15 years from now.
Oh, wow.
I'm not joking. Like the pandemic really changed how we're doing everything.
Yeah.
Thank you. And then go ahead. Okay, Barbara, then Robert.
Hey, Barbara.
Hey there. I thought Letty was ahead of me.
So did I. I think she might have lost her place, but
Okay. Sorry, Letty. First of all, 2 thumbs way up for going a deeper dive on the planetary energies.
Oh yeah.
Like way up and soon.
Yeah. We might be able to do it in October. Yeah.
Great.
Yeah, yeah.
And I have a sort of oddball question, but
Mhm.
I think a few weeks ago, someone asked you about the impact of tattoos on the energy body.
Mhm.
And it came up to me as I was watching some of the Olympics and the massive amount of tattoos these swimmers and runners have, and just wondering, are they so trained that it doesn't impact them, or would they be
No,
even stronger for form?
it still impacts them. You know, like depending on what the image is, it will have a little bit of impact on the physiology. But the other thing is the area where the tattoos are, it's a little bit makes the energy body leak a little bit, like it drains it a little bit.
They're watching swimmers with massive tattoos on their
Yeah,
shoulders and
yeah,
arms, and
yeah. Yeah, they still can function, but yeah, yeah.
Imagine if they didn't have them. No, I'm just kidding.
Right. Yeah.
and so aside from the image, what else impacts its effect on?
It's just the image and then the leaking, the leak that it causes. Just those two things. I mean, the leak's not massive, but it's enough. Like it's not so much about that it like will impact the physiology, but it potentially doesn't allow the like if it's like say for example if they have a tattoo over the shoulder and down on the chest a little bit, it might not allow the heart to like fully activate like it could. Like it
Hmm.
would still activate. It just wouldn't, you know, like I've seen people where the like the chakra should be like this and it's more like this. And so it's like it's still activated. It's just that like part of it just doesn't activate quite like it should. So I don't know that it causes like health problems, but it's a little depleting to the energy body. To the average person, it probably it doesn't matter. But as the energy body gets more refined, it starts to be a little bit more of a problem, you know. But it's not a massive problem. It's just a little bit of a problem, you know. I once treated a person who um she kept having Kundalini syndrome, like really super bad. And, you know, I would treat her and she'd be okay for like a month or two, and then she'd have it again, and then I'd treat her again. And I was like, man, she wasn't even really meditating that much. So I couldn't understand why she was having the Kundalini syndrome so much. And then I kept asking her, like, did you fall and hit your tailbone? Or, you know, like I'm trying to figure it out. And you know, I kind of gave up because we weren't finding anything. So I was just treating her whenever what happened. And I don't know, somehow we got on the subject and she started telling me about her tattoo. And she had written or had a tattoo of I think it was the Gayatri mantra, like down her whole spine.
Hmm.
And I was like, how long have you been having this issue? And it was about 6 months after she got the tattoo. And so, you know, I don't know that there's a lot that you can do about it. You know, maybe getting it taken off, but you know, she had it done right on the spine. And so the energy of the Gayatri is good, but it's hitting that spine and it's throwing the energy body out of balance. So like there's a good example of like even a positive one on maybe an area that's not the greatest being on the spine like that. Like had she done it on her shoulder or something, it wouldn't have happened. But because it was directly on her spine like that, and it caused a little bit of an issue.
Yeah, I noticed some on the spine of some of the divers, and I thought,
Yeah.
wow.
Yeah. Yeah.
Anyway,
Yeah.
thanks for indulging my curiosity.
Yeah. Yeah. It's kind of interesting. But it's a lot like going up a downward moving escalator. You can still do it. It just takes a little more effort. You know, it's just you gotta have a little bit more pep in your step. You know.
And then go ahead, Robert, then Letty.
Hey, Robert.
Hey, Greg.
Hey,
How are you doing?
I'm doing good.
Oh, good. I have a new client coming this week, Her primary concern is about bursitis.
Okay.
And I'd like to know if there's like a simple treatment with oils, like at a symptomatic level, or if there's even something we can do with or programming in any of the series, because I think both could be appropriate for her.
Okay. Do we know the presenting symptom? Like, where's the bursitis at?
It's her right elbow, both sides. So double bursitis.
And is it like work related, sports related?
It's most likely work related. She is a physical therapist.
And she thinks it's bursitis more than like tendonitis or tenosynovitis. My guess is it's probably like the tendon in the sheath, which you would still call that kind of a bursitis. You know, tendonitis is the tendon gets inflamed. Tenosynovitis is the synovial sheath gets inflamed, and so that's also where like the lubrication would come in. And so if the bursa or the synovial sacs are inflamed, sometimes they don't release the lubricating fluid like that.
Okay.
And so the way that I would treat it at first, and be it that it's tendonitis or tenosynovitis or a little bit of bursitis, this is still a great treatment, is to take like you could do just helichrysum and Eucalyptus citrodora, but I would actually put yarrow in the mix, just because it also has a little bit adds a little bit to the anti-inflammatory process, and also adds a bit to the like the tension in the tendon or the muscle. And so you have an anti-inflammatory component, you have an antispasmodic component there. And then one of the other things that I have people do sometimes when they have really bad tenosynovitis or like a bursa related issue is I usually have them take flax oil. Like you can just get capsules, or you can, at the health food store, you can get the oil, but you got to keep it like in a refrigerator. Like, so I always find the capsules to be a little bit more stable and easy to use. But if you have them take a bit of the flax, it also will help to reduce the friction in the tendon and sheath, and that will reduce the inflammation. That also will then reflect on the bursa. The issue is like when the tendon and sheath start getting inflamed, that inflammation a lot of times will shut down or reduce the function of the bursa sacs. So the more that tendon and sheath get inflamed, the more likely the bursa sac is going to stop lubricating that tendon sheath area. And so the more that you reduce inflammation in that, a lot of times that will help. But you use the flax to kind of like supplement the lack of synovial fluid in that area. Like, you just lean on like, okay, the synovial sac's probably not functioning like it should. We'll use flax oil to lubricate that area until the synovial sac is functioning better.
So the mix you talked about, helichrysum, Eucalyptus citrodora, and yarrow.
Yeah, you might be able to get away with eucalyptus and citrodora and helichrysum, but I would just do equal parts of all three, and then put it in. You can just put it in massage oil. Like in an ideal world, you would put it in like a fatty oil extract of comfrey, or like you get, like, how sometimes at the health food store you get like a comfrey cream. and you
Okay.
can mix it into the cream and then rub it, like, put the drops in your hand and then squirt some of the cream on and then mix it like that and then just rub it on the area. But
Is it more apply it to the area, or is it massage it in, or
yeah, you rub it into the affected area. Yeah,
with firm pressure, light
doesn't
pressure?
matter. Just get it in. Yeah.
Okay.
I mean, you're rubbing it, so she's a physical therapist. She might want to dig in on her muscles and tendons a little bit, but it's really the oil that's going to do probably more of the work.
Okay.
Yeah,
Great.
yeah,
And
and that's real simple. That you can you can give her instructions and have her do it, and she can do it on her own and the flax oil, and do whatever healing you're going to do on that, and but usually the topical and the flax you will most times get it, especially since the elbow is not weight bearing, or the thing that you also look at is if there's a repetitive motion, like the checkout clerk, always scanning,
right.
like with your hand like that, that starts to be a little bit more. And then you get people like soccer players, tennis players, runners, cyclists, things like that, where they'll get it like in their hips or knees or something like that. You need to be a little bit more aggressive, and the more aggressive approach would be to treat the affected muscles like you're talking about. Like, do you dig in and rub, like, so on the elbow you would treat like a little bit of the forearm, but you'd probably go more into like the bicep and the tricep and use like antispasmodics and kind of dig in on the tissue or something like that. But usually at first, like if she's doing physical therapy stuff and everything, I mean, the other thing that's always a concern, especially when there's like elbow or wrist pain that's on both sides, is that there could be a little bit of a neck issue. But this is what I like to treat it is, I like to treat it at the site first, because I want to see, like, if we do the topical treatment, are we truly dealing with tendonitis or tenosynovitis, or are we dealing with those conditions that are being aggravated by something in the neck where the nerves are being affected, and by the time it gets down to the elbow, it's causing that issue as well. And instead of just treating a whole bunch of things, like I like to treat something for a little bit, for like a week or two, and then see how the person is responding. And if it isn't resolving, like at an adequate rate, then you go, okay, we're still doing that, but now we're going to also treat the neck. If she's a physical therapist, she's probably aware of if she has issues with the neck.
Yeah, she did mention in passing that she was having some issues with her shoulder, but she didn't seem concerned about that. She did not say anything about her neck. She's very intuitive in finding things in people's bodies. So I know she's doing the same for herself in that area.
Yeah. I would start with like just being like site specific.
Okay, great. And then I'll get back to you if there's more info and we can tailor it.
Yeah.
Thank you.
You're so welcome.
And then go ahead, Letty, and then we have chat questions.
Hey, Miss Letty.
Hi, Greg. Hi, Sam. How are you doing?
Hey.
Greg, I have a couple of questions. First of all, for someone else, Hashimoto's disease, is there anything for that? I mean, I know normally for the immune system, you always say Moroccan time, but what about for that?
I'd probably start with clove.
Clove.
Yeah, I'd start with that, and it's going to take a little bit to treat, but a clove would be the first thing that I'd start with.
And would that be internally, or that would be?
It would have to be internal. Yeah.
It would have to be internal. Okay.
Yeah.
And is that like 3 times a week? How often do you think this person
daily. Yeah.
Daily. Okay.
Yeah.
I was wondering also, I did the work that you had asked me to do on Ruben, like you had said to do the violet on the blood purification.
Mhm.
And arms, clean the arms and legs. I was just wondering like if you were able to check like if that was enough or I needed to do like another session. Things are actually okay, but I just wanted to check.
Yeah, they look better. Yeah.
Okay.
Yeah,
thank you.
that person with the Hashimoto's,
Uh-huh.
you might have them also work with some helichrysum, like on the organs of blood purification,
Mhm.
just to calm down some agitation in the body that would contribute to the autoimmune issue.
Okay.
Yeah. Basil may not be a bad idea, but I mean, you also don't want to overwhelm him with like, here's this thing, do 15, you know what I mean? Do 15.
Yeah.
So like I'd start with clove. If they're open a little bit more, they can inhale the helichrysum, and then I'd stop there and let them just do that for a little while.
Okay.
You know,
Yeah, this would be like kind of kind of new to her.
yeah, then I'd start really soft.
Okay.
Yeah.
Greg, one of the other questions I have is I know we're like just on day 2 at work, but I don't like the feeling I get in my office with my secretary and the other coordinator. Prior to starting work, I worked, in the summer, and I had the exact same secretary. But now that we're all there, there's a little bit of a difference. And I just feel like if right now we're doing a lot of moving around, like we got to meet over here, we got to meet over there. And they had kind of like told me, like you said, y'all need to stay together. So the campus needs to see y'all together, so that way y'all we need to build like this relationship so the campus knows that we're working together, and yada yada. But it doesn't seem like they want me to walk with them.
And so the issue is you just feel uncomfortable.
Yeah, because I feel it,
Yeah. I mean the issue is that you're establishing a new pattern. So I'd say let's treat you feeling uncomfortable. Let me think about this for a second. Like you feel self-conscious, or you feel like their stuff.
Like I feel the rejection. I mean, I don't know if I'm feeling like if that's like
Can I ask you a question? Like how do you feel like when people don't like you? Like is that upsetting to you, or can you just go, eh?
I think it depends who the person is. There's sometimes it does
Yeah,
matter, and then there's sometimes like, yeah, I could care less. I'm thinking I'm still
right,
gonna sleep at night,
right. So like in this situation, how does it, I'm not saying that's what it is, but I'm trying to gauge your threshold. Like, so is it more of a thing here, or is it more of a thing where it's not really an issue?
Mm, I'm not sure. Like it just makes me feel bad, like I'm not letting it all like oh I'm like super depressed or letting me get down, but it just
No,
doesn't
but it's still
feel
feels like there's
fun.
something you have to resolve.
Yeah,
Yeah.
and
Okay.
I know I'm having to establish some things because I'm new, whatever, but I don't know if she's pushing back because she wanted the position, right? And she didn't get it. The other coordinator.
Who knows? Like it could be that, it could be change, it could be they think they know how to do it better, like who knows? Yeah. Um, You did the weekend, yeah?
Not really. I did part of it only because I had to go
Do,
to
do the east. Do the east.
East. Okay.
Mhm. Yeah, do the east. Because there's the part with the east where you do like chakra breathing with the area between the eyebrows and then the backside and then the sides of the head. Part of what that does is it is stimulating to the mental permanency that's in the pineal gland.
Mhm.
And the more that gets stimulated, the less sensitive you become to the environment. Like
Okay.
you don't get like thick skinned, like because cinnamon would be a thing where you go like, well, you need a little thick skin, you could do that, but I think this is a little bit more like of a dynamic issue. Like that it's not just you being around people, you're having to interact, you're having to give them instruction, you're going to have to direct them, they're going to push back, how are you going to handle that? You know what I mean?
Mhm.
It's not just like they don't like me. It's like you have to play a little politics and you know what I mean? Not
Mhm.
politics, but you gotta kind of play politics a little bit.
Yeah.
And so the the East will help you with that.
Okay.
Yeah.
All right. Thank you so much, Greg.
Yeah. And Letty,
Yes.
any form of, where you do meditation on that blue pearl or that mental permanent seed can
Mhm.
be helpful. Like even if you just sit and do like a little, put your attention on that area and just sitting there for a little bit. The problem with that sometimes when you don't temper it, I'm not saying that this is going to be a problem, but I'm just like kind of telling you like the mechanics of things.
Mhm.
When you meditate on that area for a period of time, it can be so stimulating to the mental body that if not tempered with heart practices, you can be so blunt that it's like and so like like pushing forward that it almost like makes you like a little bit abrasive. And so when and it's not that you're doing anything wrong, it's just that it needs a little bit more heart, right?
Mhm.
To like soften how you do things and how you say things. So here you're having the opposite. Like you have like heart, but need a little bit more of stimulation in that area so that when people push back, you just go, this is what's going to happen. Like, I don't know what to tell you. Like, you have a job to do and you have responsibility to do.
Mhm.
And so, um,
At the end of the day, it's
you are
we're
going to
gonna have
get pushed.
to.
You are going to get pushed back. Like I guarantee you. Like it's not because of something you did, or it's like the more you go up and have more responsibility or authority or something like that, the amount of pushback directly corresponds to that just because of the position. And so part of it is it will increase your ability to like direct things, but it will also make you like less sensitive. Like it's great to have a big heart, but like when you get in situations like this, it also like tickles or hurts a little bit, you know what I mean? And
Yeah.
so um the thing is it's not that you're making it go away, but when you're at work, you can be a little bit more one pointed and like have or feel more directed. And then when you're around your family or at your downtime, you can shift and the heart can be big and you don't have to be like that. And so um yeah, it's just yeah, think about all the questions you always ask. You're always asking about other people. You have a big heart. And so you gotta just have a little bit more of that blue pearl stimulated, so that when people are misbehaving or pushing back or something, it doesn't hurt the heart as much.
Okay.
Yeah, that's all it is. It's not even like that it's an imbalance. It's just it's the world would be a better place if everybody had, a bigger heart, especially in some circles. But
Yeah, I just can't help but to feel bad because I'm thinking like, wow, like I'm here, I'm new, and like regardless of whatever, I'm still gonna be like their boss and whatever. And at the end of the day, they're still gonna have to do what I say. But
yeah, you want everybody to get along, and
yeah.
I get it, but sometimes you can't save people from themselves. I've tried. It doesn't always work. Sometimes it does, but it doesn't always.
Okay.
Yeah.
Okay. Thank you, Greg. Thanks,
You're
Sam.
so-
Yeah,
Sam, I'll be sending something here when I get a chance soon. Those stuff that Greg needed.
okay.
Oh, thank you so much.
You're welcome.
Is the star having a special event this weekend? A meditation showed up on my feed today. It's led by a man that looked thin, glasses, grained, shortish hair. A star is doing a special event this week. Not sure what the picture showed. It might have been a picture of Master Choa when he was younger, because that's what Master Choa looked like when he became an Astarian-ish.
Oh, could have been. I don't remember him wearing glasses early on, but
Yeah. But
yeah, Thursday night at 5 Pacific time, 7 Central time, we're doing a thing for Master Choa, who was, the modern day founder of pranic healing, but he was also a very long time Astarian, and Astara played a role in the development of pH. So it's his birthday on Thursday. So yeah, we're just celebrating that, just because I think he became an Astarian 52 years ago. Like yeah. So
and somebody wasn't sure what time the practice for the Dorji and Ankh is, but it is right after, and it is at 8 p.m.
yeah.
Central. So if you have a Dorje or Ankh, email us if you'd like to join that.
Mhm.
I would love to know more about these vital centers of the brain.
You have like a specific question, or
That was me, Greg. This is Barbara.
hey,
I often go
Yes.
through the series inhaling them during this session. It feels like I have this great batch of oils and I want to be making better use of them. So I'd like to understand what to do with
yeah,
them.
so the
I know how we used them originally, and that was wonderful. But just
yeah, the
feel like
vital
there's more.
centers, yeah, there is, yeah.
There's always more.
Yeah, yeah. So the vital centers, like those are based on things that are taught in Astara and in Buddhism, and a bit in Kabbalistic practices. And you're literally kind of going through and working the different aspects of these vital centers and limbic functions to help, for one, like regulate the instinctive responses, starting to develop um, um, higher faculties when it comes to the emotional body, but also like how you emotionally learn and process and also shaking off the past. And so one of the things that I noticed over a long time ago was that people who had really super chronic health issues, like things like cancer and things like that. One thing that they had in common was they had a lot of agitation in those vital centers. And so the vital centers, you know how we talk about automatic behavior, automatic thinking, they play a significant role in how we respond in that automatic way, those automatic thoughts, those automatic behaviors, things of that nature. And so, and then when it comes to like change cycles, things like this, those centers can make us more resistant to change or to the shift that's associated with cycles and the law of cycles, or they can make us more conductive depending on how calm they are. Like when somebody's really having a difficult time, you could say those vital centers are really like wound up, like they're really agitated. And when a person is able to feel calmer, it's not just that the tension in the body's down, it's that the vital centers are calmed down substantially. And so it's not something that's tied, like our thoughts don't make it that way, our emotions don't make it that way. It's tied up to a lot of instinctive responses, but it eventually affects the emotions and eventually affects the mind. And our potential for spiritualizing or having spiritual energy, experiencing spiritual energy, somewhat is dependent on the development of those different aspects. Like if those things are developed, then our potential to really grow at a much more rapid rate is somewhat hindered. You'll make more progress and then slide back, progress and slide back. And so like when those centers are regulated, when you make that progress, you kind of hold on to it longer. And even if there's times where something happens and you get agitated, you actually kind of pull out of it eventually. Where for the average person, when they get agitated in that area, that's the way it is now. Like it just kind of stays that way. And so, in the processes, you're calming them down, but you're re-educating them so that they don't just keep doing the same things over and over again. You're allowing, or you're helping to facilitate a greater level of potential for spontaneity. So intuition, soul energy, Buddha nature, whatever you want to call it, but just the healing process. And so there was a while that when I was treating cancer patients, that was like one of the big things that I would do is I would treat that. And sometimes the issue is though just the amount of time, and cancer patients usually start not feeling good and they get overwhelmed with doing so much intense work that we just sometimes I let it go and just focus on the condition and just try to do the best that I can, because the treatment sometimes, they might be going through chemo or radiation or had intense surgeries. And so I still use it quite a bit with them, but it depends. It depends on where they're at and how much they can handle. But for a spiritual practitioner, like in the early days, like before I would do any angel work, I would always work the vital centers. But now we've done so many other things that it's not quite as necessary as it was now for the angel work. Now I do it more for just like helping to facilitate like deeper and better cognitive functions. Yeah. What I'm curious, what's your experience when you do?
It's interesting because I tend to inhale them until I have some kind of response, and after 15 or so inhalations, if there's nothing, I move on to the next one. And there's some that often provoke some kind of response, but it varies from week to week. And I think that's what caused my curiosity about what do I
So
do when I have a response? Is there a
yeah,
particular
I
pattern?
would
Does it mean there's a particular thing that's been triggered or an area of the brain that's agitated? Or what do I do with that?
yeah, I mean, there could be that, but I would say sometimes it's also the opposite, like same but opposite. Like instead of spinning downward, you're spinning upward. And sometimes what happens is like, 1 week you might have, one of the centers might be like, oh, this one really worked me. And then next week, not really that much. And as you spin upward, it's going to bounce around and shift around as well. So it's not always that it's going downward, but as you like expand consciousness and awareness, the different pieces are going to be like kind of holding you back, so to speak. Like you can only move in that direction so much, and then you have to kind of unwind a couple of those to move further, if that makes sense. And
Yeah.
and so I would say that it was probably more an upward spiral rather than a downward spiral. Yeah.
Yeah, I wasn't perceiving so much as downward, but I just
My early
that's a
days,
helpful
it
way to
was for me in the early days, it was always a downward
well,
spiral.
what I had yesterday with the thing on the right side of the head was Sunday, but which has resolved. Thank you.
Oh, good, good.
Is there something more targeted I could do other than just inhaling them in sequence?
Um,
Like if one seems to be like I'm yawning a lot, or I feel it in a particular part of the head, or just inhale them.
Start doing them in the pattern of the three brain.
Ah,
Yeah. Like with probably more emphasis on the sex chakra and Ming Men. And then, you go solar plexus, back heart. And then when you get to the brain, a little bit more emphasis there.
okay.
So do sex, Ming Men, solar plexus, back heart. And then, with that, the potential is that when you're starting to do that, you have a greater potential of purifying like the astral body. And so a lot of times what happens, like when we start purifying the astral body, the two places you'll feel it is in the back heart and then the brain. And so there's a direct correspondence to how purified the astral body is to how much intuitive activity there can be. And so it's a good thing to do it, but sometimes when, because you're working the sex and the Ming Men, and that's really what kind of stirs it up so that it can be purified in the back heart. But the back heart and the brain are so interconnected that as the back heart lets go of something, you're going to feel stuff coming out through the top of your head, or your brain will feel a little like foggy. So that's why to linger on the brain for a little bit,
Okay.
and it will have like a deeper purifying effect. And if you do that for a while, you don't even have to do like all of them at once. You could just like pick one, like you said, like maybe go through and you go, okay, this one's really rocking my world. Then just work that one and just do several cycles of it.
Okay.
So what you could do is you could just pick one a day or one a week or something, and then just keep working it until something feels like it moved, and then move to the next one. But it will make the back heart like it's not that the back heart is letting go of something, it's that those lower emotions and some of those instinctive responses are moving up and then hitting the back heart, and then the back heart has to go through and purify it.
Right.
Because the if they don't, that'll just go right up into the brain, and then it will cause your mind to be like more repetitive, more agitated, more critical, whatever that might be. And so the more you can cook it and transmute it in the back heart, the more that it will refine the brain and open up the brain and the mind so that mental things get released eventually.
Right. And have the perma handy.
Yes.
Speaking of that, when you were doing this, is there an optimal place to hold it? I couldn't tell if you were holding it high enough to catch the camera. Like, is it in front of the heart? Is it in front of the solar plexus? When you're pointing it to the ground, the perma.
Oh, I was doing it so you guys could see it in the camera.
Right. So is there
So,
an
like,
optimal place to hold it? If you're
I start up high and then I go all the way down when I'm doing it that way. But if I'm holding it, just wherever your arm is comfortable.
okay.
Yeah,
Thank you so much.
you're so welcome.
And then in the chat, and then we'll get you, Lolly. So could you please recommend something to help me stay asleep at night? I usually fall asleep easily, but can wake up several times. Sometimes I go to the bathroom up to 3 times.
Is it because you're going to the bathroom, or is it you just start waking up and can go back to sleep?
I just wake up.
You just wake up. So, what's stress levels like in your life? Is there things going on? Do you feel stressed out about something? Or is there things on your mind?
Sometimes I have to go to the bathroom. It's an internal struggle.
So it is that you're having to go to the bathroom in the middle of the night?
Not always.
Okay. Well, let's talk about two things. So one, let's talk about the urgency and frequency of having to go to the bathroom. There, I would start with Sylvester pine and 3 or 4 drops on the wrist 1 to 2 times a day. You don't even have to inhale it or anything. You just put it on the wrist, rub your wrist together, call it good. And usually within a couple of days, that will reduce urgency and frequency. And so if that is part of what's waking you up, I mean, it's very possible that urgency starts to wake you up, or you have the experience of like, I need to go to the bathroom so much, I'm afraid to fall asleep because I'm going to have to go to the bathroom in a half hour. So you're kind of waiting, it's not conscious, but you kind of get into a little bit of a pattern. And so if you calm down the bladder and things, that can be helpful. Second, when you have the ability to fall asleep, but then you can't stay asleep, sometimes there could be a little bit of a adrenaline starting to kick in. When we get up in the morning, there's a little bit of adrenaline that kicks in to get you out of your slumber and get you up and moving and walking around. And it doesn't last very long, but it's what kind of motivates you to get out of bed. And so sometimes what happens is that starts happening earlier and earlier in the night. And so, you know, things like sage can be helpful for that. Sage might be the best one for that. Yarrow might be very good for that as well. Yarrow can be calming down to, like, if the body's getting triggered or you're having a little bit of an adrenal response. Yarrow can be good. You just take it, you know, take it internally right before you go to bed. And you could do tincture or you could do the oil. The other thing is, you know, they did this study many years ago, and they found that when people took a little bit of St. John's wort right before they went to bed, you know, St. John's wort's a blood purifier, but it also kind of purifies the emotions and the mind and instinctive responses a bit. And so if you take a little bit of St. John's wort right before you go to bed, there is a greater potential for you to stay asleep for longer periods of time in the night. You still could use something to make yourself, you know, sleep deeper, like spikenard or tarragon, marjoram, you know, even lavender. These things could help you, and you can just inhale them as you're going to bed. Those can be helpful, but I'd probably put the Sylvester pine on, just because you do have, you know, if you're getting up 3 times in the night, that could be a little bit of an issue. And then, you know, either support it with St. John's wort, or you can start with one of the other ones first, and then, but if you know, the oil is there, but you could also get like a tincture of St. John's wort as well, and try that. I don't know that we have ours on the site yet, but you could pick it up at a health food store or something. The only thing that I would say about St. John's wort is, if you're using a lot of medications or something like that, the St. John's wort is a blood purifier, and it might diminish the potency of the medications that you're using. And so if you are using medications, I might not use big dosages of St. John's wort. You could still do a little dosage, but don't go too crazy with it. Yeah, do that and then report, you know, give us a report back and let us know, and then we can make adjustments if need so.
Thank you. And then go ahead, Lolly.
Hey, Lolly.
Hey, so a couple of things. One, going back to Barbara's question, which was actually one of my questions as well, because you've mentioned the vital centers, you know, quite a few times. So, and I haven't taken that class yet. What I'm wondering about is, I know that the vital centers are connected to the brain, but I actually don't know exactly what they are, like breakdown of what it actually means. Like, I don't know if it's like,
Yeah, they're the
yeah.
limbic functions. Yeah.
Okay, so that
yeah.
was the next question. If the limbic system would be the vital centers, if it's the same thing, basically.
They overlap quite substantially. Yeah.
Okay.
Yeah.
So in terms of where it is in this, so we're not really looking at specific parts of the brain, but you're looking at something that's more general in a way?
No, there's specific parts of the brain in the anatomy, but we're also looking at function, but also their influences. For me, I usually look more at their influences rather than, you know, those vital centers. They're influenced more by things that happen in the body than they are just about the things happening in the brain. So, you know, if you're working that, like how I said for Barbara, you could work the 3 brain component, and that would be good.
Right. And then when you're working that, I wasn't sure if you were referring to something in class with a specific oil, or is it
Yeah,
something
there's a whole set
So-
of oils for
right? So I
yeah.
saw, okay, so it has to be with
Yeah.
something. Okay,
Yeah.
okay, it's on the list now of classes to take. So
Yeah,
okay,
we are going to do that class before the end of the year. Yeah, that's
okay.
a
Then
class
it,
it's I really like it, but I think it's Samantha's personal one of her personal favorites. So
okay, then it,
and we really have only kind of scratched the surface of that class. So well, I think we've already done a 2.0. We're going to do a 3.0. Yeah.
okay, then I'll put it up on the list so I can start, catching up. Okay, perfect. Thank you.
Yeah, so-
And then quick one, and then another one. When we talked earlier about, which again relates to something asked before, when we talked about rosemary, verbena, and taking it for the sinuses, if you were to take mental still, for example, that has that in there, you would still take it separately because it's for different
Yeah.
purposes.
yeah.
Okay.
You're wanting the rosemary by itself.
Okay, so but then if I were to take mental still, it's fine. It's just like a little bit additional. There's nothing. Okay.
Mhm.
And then the other thing I want to follow up on actually, the right foot that's keep getting numb, the right leg basically. I've been using nerve help on there.
What's happening?
So
What's
my
the-
left leg keeps getting numb, like it keeps falling asleep for no real reason.
Like
And
the whole leg or
Mm.
just part of the leg?
I feel it mostly like from the knee down. It feels weird, and I feel it mostly on my foot, but like the entire leg, but there's like a weird sensation. And I've been doing the nerve help body tonic now for the last few weeks or so.
Where
Um,
where are you putting it?
the entire leg. So starting because I have an injury
I
in
would
that
do it.
side for the back, so I'm going, yeah.
I would do it on your back. Like I'd still do the leg, but I'd
On
put
s-
a lot on the low back.
So okay, because
Low back and your hips. Yeah.
I've been starting from the hips, but I'll add okay, but
Yeah.
still
It's your low
use
back.
okay, and
Very good
then
chance that's a low back issue.
okay, so and then using the
Do you
body
have low
tonic.
back issues? Do you have like
Yeah, I
yeah.
broke my pelvis 20 years ago.
Oh.
So and I'm
What
fine.
did you break? You broke like you
I
fractured it or
broke
you like had to have it pinned
so
together or
so one side I kind of broke, and the other one I really smashed. Like and I don't have. It was 20 years ago, and I have like bits and pieces of information. Basically, it's mostly the right side that I feel sometimes pain, and it's
but when you say broke, it was a fracture or they had to pin things together? Like
no, they didn't pin anything together, but it was more than a fraction. Like it was more serious than that. But I have to look at it's one of those things that I can't even, I have it in my notes somewhere that I have to find, but it was, yeah, but I didn't need to put anything on there. But it's a matter of like, I had to teach myself like how to walk, yeah.
did you injure your knee in that accident or that injury?
No, and that's all the same car accident. And the side that sometimes is kind of painful.
So when you
Kind of
got hit, you hit somebody, they hit you,
Yes, I hit the wall.
you hit a wall. Straight on or at an angle?
I don't, I maybe,
You don't
I think
remember.
I think in an angle, because I was like I think it was in an angle from my left, so from the driver's side to the wall, the divider wall of the freeway.
Okay, let me just think about this for a sec. Besides the sinuses, are you having breathing issues? Do you have like short, rapid breathing? Do you have like hiccups? Do you have
No.
no? You're able to take long, slow, deep breaths. You don't have bronchial spasms that you're aware of?
No, fine.
Okay. A couple of things. You definitely have like a big spasm in the psoas and the iliacus, which is the inside of the pelvis on that side. I mean, there's the little muscles that run up and down the spine that they're also impacted. Vetiver is good for the multifidi, those little muscles. Applied topically, or you could inhale a lot with your awareness on. I would do your whole spine because it looks like it kind of bounces up and down your spine. You're feeling it more in the low back because of this issue, but I would do the whole spine. I would inhale Palo Santo on the perineum and the sex chakra, the navel, and the basic, even the Ming Men, like those lower centers like that. And if you can, try to tap into like any tension that you feel in the low back or the inside of the pelvis. And then after you're done with that, sit with your back up against the wall, like so that you're at like a 90-degree angle, like your back supported by the wall, your legs are straight out in front of you. You could actually inhale and then just let, you know, how like you let go and just relax for a little bit, relax into the wall. Like, you know, you're relaxing your back into the wall, your legs are at that 90-degree angle. Like let yourself be there for probably a good 10 minutes. And then after that, you know, the cobra pose in yoga, you know, where you
Yeah,
lay down and you push your
yeah,
front. Do that, but very gently. So you're still using the nerve help, hit your low back, vertebra on the low back, Palo Santo in those areas, and then do the 90-degree angle up against the back of the wall, and then the cobra poses. Like do that for about a week, and then let me know how that issue is with your leg. We just got to unwind that psoas. Yeah.
and it's all coming. Okay, thank you. Yeah, because I'm like, I've been doing that and I'm like, something is still, and also, I mean, it feels like it's coming from up there. I mean, because that foot, what I also been using is because I had previous injuries to the foot. I broke it and I sprained the ankle. So I've been using taggets on the foot as well. But I don't think that you're connected.
Yeah. Probably not, but it's still, you know, it's still a suspect. You know what I mean? It's
Yeah.
probably not, but
Mm-hmm.
you know, until we know their story, I don't know. Like I
Yeah.
mean, you never know. Like you know,
Mm-hmm.
because you're
Okay.
feeling it in the lower leg. I mean, more times than not, it comes from up above, but it
Yeah,
can
it feels
come
it's
from
coming
down
from there.
below. You know, it
Mm-hmm.
can come from down below, but
Yeah.
that usually is less common. And
Okay.
so,
Okay.
you definitely have like a bunch of tension. I mean, that's the thing is like you're, you know, there's the soft tissue injuries, but like when you hit, you have like this kind of like bouncing back and forth. You know, you have like that.
Mm-hmm.
So it depending on which direction you hit, it can cause over a period of time. It's just as time goes by, the problem just gets a little worse and a little worse,
Mm-hmm.
and a little worse and a little worse. And so nerve help. You know, I'm liking more and more the ginger for you as we're talking this out. I think ginger baths could be really good for you.
Okay.
You don't have to jump on it right now. I know you're getting ready to like take off and go, on your trip, but maybe when you get back, like that would be the thing to start doing, is maybe some ginger baths.
Yeah. Okay, because you want the end when I'm doing that, bats are a little bit tricky, and I tend to do more the feet, but when I'm doing the back, really, because the idea is to get that area on the back.
Yeah, I mean, even though we're looking at trigger points, you still got to do things to unwind it.
Right.
Like the difficulty with stuff like this is like at first you do it and you're not really getting very good results because you're chipping away at something. But as time goes by, the effects of the treatment start to get bigger and bigger, and then pretty soon you start making big improvements. But it starts off with a lot of little ones.
But the idea when doing the ginger salt bath is getting to those specific areas to that specific area
You
in the
have to
back,
start
right?
increasing like trigger point activity in your whole body. Like that's
Okay,
like we were talking about it up here, and then
Mhm.
now you have that going on down there. It's like at some point you just got to go, okay, let's treat the whole body, and then we'll go specific again.
Right. And if salt baths are kind of tricky, would it help to do like the feet in salt water? Not so much.
In if it's with ginger, like do it with
Yeah,
ginger.
that's what I'm,
Yeah, you could do the
Okay.
feet, you do the whole
Oh,
body.
okay.
Yeah, the whole body.
Okay.
Like it really
Okay.
gets your neck, and even like kind of go down and let your jaws like soak in it for a little bit as well. Yeah.
Okay.
The one thing is that will probably actually improve your sleep too.
Okay.
Not directly like, oh, I'm gonna fall asleep easier, but like that deeper sleep where your body is restored, those restorative processes, that like it will help that.
Mm-hmm. Okay. Okay. Thank you. So yeah, I'll start doing all the things. Thanks.
You're so welcome.
If you're taking herbal supplements, can you still do St. John's wort?
Yeah.
And we have the relationship healing free class and the divine self free class up on the site. We're gonna get info for you guys either tonight or tomorrow. Right, okay. But will you go ahead and just talk a little bit about those? Or you don't have to, but I just thought I'd put you on the spot.
So with the relationship class, we're looking at dealing with different kinds of communication, verbal, nonverbal, and active listening. And then we're dealing with emotional exchange, so empathy and emotional support. We're looking at the cultivation of trust and reliability, power dynamics, which would be like mutual respect, balance of power in a situation, things of that nature, conflict resolution, and boundaries. And so we'll be going through and doing protocols for each of these aspects. And so it's not necessarily just about like your personal partner, but it could be family dynamics, it could be dynamics in the workplace, it could be just social interactions. It doesn't always have to be like the person you're involved with. And so yeah, we'll have an explanation that goes out, but we're going to hit those key points. In the past, we kind of did more of an energetic approach to relationships. That was like 4 or 5 years ago, maybe. And I wanted to do something different with the approach than just kind of revisiting that. So I just kind of went through like bottom line, hit those markers. So again, you're looking at communication, be it verbal, nonverbal, active listening, emotional exchange, cultivating trust and reliability, power dynamics, conflict resolution. So addressing conflicts and the ability to compromise, and setting boundaries and respecting boundaries. And so, yeah, it'll be kind of a fun class. Who doesn't like talking about boundaries? Yeah. Yeah. You know, I think that's a word that got a little overused in certain circles a little bit, but you know, anyway. Oh, and then divine self, it's the divine self will be, I have to look at my notes. I've done about 4 or 5 different classes in the last couple days. So yeah, so here we're looking at different aspects of vibration. And so gotta find my notes. Yeah, that one I'm still scratching out the notes for that one. That one we'll just do tomorrow.
Okay.
Like
Yeah, you'll be able to
yeah,
explain it better.
like I've written like 4 or 5 different classes, and so they all are blurred together. So I'll pull that together for you there. Sorry.
And go ahead, Lolly.
Hey, Lolly.
Just a quick follow-up question. If I were to do, if you were to make me a ginger scrub, would the ginger salt scrub work the same as the salt bath?
It might, but I would prefer the salt bath. Yeah. Like
Okay.
if you wanted to substitute the salt bath, I'd almost do like a ginger body tonic.
Okay.
Like that would be better than the salt scrub. Yeah.
Okay. Okay.
Yeah.
Perfect. Thank you.
You so.
But foot soak, would that be better than the body tonic for the ginger? If you
Just-
can't take a bath, that's why.
Just for the feet.
Yeah.
It
Oh,
wouldn't
okay,
be
so-
wouldn't be for the, you need to get the ginger all over your body.
Okay.
Yeah. Yeah. Yeah, you gotta calm down the trigger point activity.
Makes sense.
Yeah.
We have a little time.
Yeah, let's do a practice. We got everybody's questions?
Yeah, that I could find.
Okay, let's pull out, if you have Eucalyptus Smithii, if you have lavender, or if you have Melissa. If you don't have one of those, maybe lemongrass. If you don't have that, let us know and we'll find you a sub. Okay, so you have your oil. We're going to do the 4 quadrants of the aura first. So here we're breaking up physical blockages in the body, in the emotions, in the mind. Okay, so your awareness is on the left side of your body, left side of your face and neck, your left shoulder, the left ribs, left hip, down the outer left leg to the left ankle. Nice, long, slow, deep breaths. Nice, long, slow, deep breaths. Now go to the front side of your body. Your face and neck, your chest, your abdomen, front of your pelvis, down the fronts of your legs, down to the tops of your feet. Then the right side of your body. Your awareness is on the right side of your face and neck, your right shoulder, ribs, the hips, down the outer legs to the ankle. And then the back side of your body, back of your head and neck, your whole back, your hips, down the backs of your legs, all the way down to your heels. And then just pause for a moment. Now, go to an area of your body where there's like an ache, a pain, an agitation. You got some issue, whatever it might be. Put your awareness on that spot and begin inhaling the oil into that area. And then let them go from. Let's squeeze in another round on the 4 quadrants. Left side of your body, from the side of your face all the way down to the outer ankle. The front side of the body, your face, all the way down to the tops of your feet. The right side of your body. From the side of your head all the way down to your ankle. Then the back side of your body, the back of your head down to your heel. And then just let go. So we're going to slide over to the Astara prayer petition blessing. Join us if you can. We're going to spend like 15-20 minutes blessing the prayer petitions and doing a little quick meditation. And if not, hopefully you can join us on the weekend.